Let's talk about signs of stroke you should never ignore. A stroke is a medical emergency, and recognizing the warning signs quickly can save someone's life. I'm Angie D. Welcome to the Educating Nurse Practitioner. Today, we're talking about stroke symptoms, why time matters, and what signs should never be ignored. So, a stroke happens when blood flow to part of the brain is blocked or interrupted. So, therefore, that allows for decreased oxygen to get to the brain cells. And if that happens, then those cells can become damaged very, very quickly. That's why fast treatment is so important. One of the easiest ways to remember stroke symptoms is the word fast. So the F stands for face. So if you ask the person to smile, you look at the face to see if it is even. Is there any drooping in one side of the face? The A stands for arm. Ask the person to raise both arms. Does one arm drift downward or does it seem to be weak? S. The S stands for speech. So if you're having a conversation with someone and their speech is slurred, or you're having a hard time understanding what they are saying, that is something to consider. And the T, of course, means time. Time is very, very, very important. Every second someone is having any of those symptoms counts. So, if any of these signs happen, it is very important. Don't wait to say, oh, let me wait and see if it's going to get better. No, these are emergencies and help must be sought immediately. I also want you to remember that not all strokes look the same. Some people may suddenly have numbness, some may have weakness, some may have trouble walking, some may have dizziness, some may have blurry vision, some may have severe headache, or some may be confused. They may have one of these symptoms, they may have more than one. Sometimes these symptoms may come and go. Even if the symptom improved, it is very important to seek medical attention because some people will experience what we call a TIA or a transient ischemic attack. This is a topic that I will speak about in another video. And sometimes these are called mini stroke. So this is basically a warning sign before a larger stroke occur. One dangerous mistake people make is waiting too long to get help because they feel that it is going to get better. Others may think they were just tired or they were stressed. If there's numbness in the arm or leg, some people may feel, sometimes you sit in a position or you lay on your arm and you get that numb feeling. So some people may just think that's what it is. Yeah, you may know that that is what that may be. However, if something comes on suddenly, you weren't in those positions and you suddenly felt numbness, that is something to think about. Fast treatment may help reduce damage to the brain tissue and help improve recovery. So, in the emergency room, the healthcare practitioner, they're going to check quickly. So, they'll check your speech, your movement, your strength, your vision. They may ask you to walk because they want to see if you have any trouble with your balance, because sometimes the symptoms are just subtle, right? And therefore, they need to conduct these tests. Other tests may be brain imaging, a CT scan in the initial phase, and later on, there may be an MRI. So the goal again is to identify the stroke as quickly as possible and begin treatment if it's appropriate. It is also important to know that strokes can happen at different ages. So I've seen a lot of stroke happen in young. The term we use is stroke in the young. Um, so in time past, stroke was only seen as something happening in the elderly population, but it's not the case. It is happening in younger individuals. Conditions like high blood pressure, diabetes, smoking, heart disease, and some other health problem can increase the risk of stroke. So again, understanding the warning sign can help individuals to act faster during these emergencies. Early recognition can save lives. Again, if there's an health topic that you would like further explained, leave it in the comment section. And thank you for watching. Please follow, please like, please share, please subscribe. And thank you, and I'll see you in the next one.